Aslan Adnan, M.A. presents Papaya, Nutrition, Papain and the Science of Nature's Proteolytic Enzyme. A comprehensive evidence-based review of the nutritional composition of papaya, the therapeutic potential of papain and the science behind enzyme combinations. Wednesday, 5th of August, 2026. Papaya. A complete whole plant review of nutrition, enzymes and traditional uses. Papaya, carica papaya, is far more than a sweet tropical fruit. It is a remarkable plant whose different parts, the ripe fruit, green fruit, seeds, flowers, latex and leaves, possess distinct nutritional, culinary and biochemical properties. A comprehensive understanding of papaya requires looking beyond the familiar orange flesh and examining the entire plant as a complex biological system. Ripe papaya is one of the most nutrient-dense tropical fruits, providing substantial nutritional value despite its low energy content. Per 100 grams of edible portion, ripe papaya contains approximately 43 kilocalories, nearly 88 grams of water, 10.8 grams of carbohydrate, 1.7 grams of dietary fiber and negligible fat. Its most outstanding nutritional feature is its exceptionally high vitamin C content, with around 61 milligrams per 100 grams. Vitamin C contributes to immune function, collagen formation, wound healing, and antioxidant protection. Papaya also supplies important carotenoids, including beta-carotene, beta-cryptoxanthin, lycopene, lutein, and zeaxanthin. These compounds contribute to the fruit's characteristic orange-red color and provide antioxidant activity. Beta-carotene and beta-cryptoxanthin can be converted into vitamin A according to the body's requirements, while lutein and zeaxanthin contribute to the maintenance of normal retinal function. The health benefits of ripe papaya arise from the combined effects of its nutrients rather than from a single miracle compound. Its high water content, low energy density and fiber content make it particularly suitable for dietary patterns focused on satiety, weight management, and nutrient density. Like other whole fruits, papaya contributes to overall health when incorporated into a varied diet rich in plant foods. The immature green papaya represents a different stage of the same fruit and has a very different culinary and biochemical profile. While ripe papaya is usually eaten fresh as a sweet fruit, green papaya is commonly treated as a vegetable throughout Southeast Asia. It is shredded into salads such as Thai som tam, cooked in curries, added to soups and incorporated into savory dishes. Green papaya is firmer, less sweet and lower in carbohydrates than ripe fruit. It generally contains fewer sugars, slightly more fiber, and higher levels of the proteolytic enzyme papain. However, because carotenoids accumulate during ripening, green papaya contains far fewer beta-carotene, beta-cryptoxanthin and lycopene compounds than ripe fruit. Papain is perhaps the most scientifically studied component of the papaya plant. This cysteine protease enzyme breaks down proteins into smaller peptides and amino acids. It is concentrated mainly in the milky latex of unripe papaya, and is widely used commercially in food processing, particularly as a meat tenderizer, as well as in pharmaceutical and industrial applications. Within medicine, papain has its strongest evidence base as a topical enzymatic debriding agent used to remove damaged tissue from certain chronic wounds. Papain-based preparations have been investigated for pressure ulcers, burns, and other difficult-to-heal wounds. However, clinical use requires professional supervision, and concentrated papain preparations should not be regarded as substitutes for modern wound care. The role of orally consumed papain is more complex. Because papain can digest proteins, it is frequently included in digestive enzyme supplements. Small human studies suggest that papain-containing preparations may assist some individuals with symptoms such as bloating, indigestion, and constipation. Nevertheless, most healthy people already produce sufficient digestive enzymes naturally, and evidence supporting routine supplementation remains limited. Research has also explored papain's possible anti-inflammatory effects, influence on muscle recovery, and potential benefits when combined with other enzymes such as bromelain from pineapple. Papain and bromelain have complementary protein digesting properties, and are frequently included together in enzyme formulations. Some studies suggest benefits in inflammation, exercise recovery, and musculoskeletal conditions, particularly within broader multi-enzyme products. However, many claims remain preliminary, and larger independent clinical trials are required. Papaya seeds represent another distinct component of the plant. Unlike the fruit pulp, the seeds contain higher concentrations of fat, protein, fiber, and bioactive compounds such as benzyl isothiocyanate and polyphenols. Traditionally, papaya seeds have been used for digestive support and intestinal parasite control. Laboratory studies have demonstrated antimicrobial and antioxidant properties, but human evidence remains limited. Small quantities of papaya seeds may be consumed as a culinary ingredient, often dried and ground as a pepper substitute because of their pungent flavor. However, concentrated seed preparations require caution, particularly during pregnancy, because animal studies have raised concerns regarding reproductive effects at high doses. Male papaya flowers provide another example of the plant's culinary diversity. Although male flowers do not produce commercially valuable fruit, they are eaten as vegetables in several Asian cuisines. They may be stir-fried, cooked in curries, added to soups, or served with spicy sauces. Their slightly bitter flavor is considered desirable, similar to other bitter vegetables. Nutritionally, they contribute fiber, minerals, and plant phytochemicals, although they are generally consumed in small amounts. Papaya leaves have attracted considerable attention because of their traditional use in dengue fever, particularly in South and Southeast Asia. Dengue infection can cause a temporary reduction in platelet count, and papaya leaf juice has become a popular complementary remedy believed to increase platelet levels. Scientific studies have investigated possible mechanisms, including effects on platelet production, antioxidant activity, and immune modulation. Some small clinical studies have reported increases in platelet counts among dengue patients using papaya leaf preparations. However, evidence remains insufficient to establish papaya leaf juice as a proven treatment for dengue. It should never replace medical monitoring, hydration therapy, or hospital care when required. The safety profile of papaya depends greatly on which part of the plant is consumed. Ripe fruit is safe for most people, and is an excellent addition to a healthy diet. Greater caution is required with green papaya latex, concentrated enzyme supplements, and medicinal preparations. Individuals with latex allergies may experience reactions due to cross-reactive proteins. Pregnant women are generally advised to avoid large quantities of unripe papaya or concentrated papaya latex products because of theoretical risks associated with uterine stimulation. The story of papaya illustrates an important principle in nutritional science. Plants are complex systems containing many different compounds distributed throughout their tissues. The ripe fruit provides vitamins, fiber, and carotenoids. Green papaya offers culinary versatility and higher enzyme activity. Seeds provide unique phytochemicals. Flowers contribute dietary diversity. Latex supplies commercial papain, and leaves remain an area of active research. Taken as a whole, Carica papaya represents one of the most fascinating food plants in the world. Its greatest and most firmly established contribution remains its role as a nutritious, low-energy, vitamin-rich fruit. At the same time, its other components continue to provide valuable insights into traditional food practices, plant biochemistry, and the ongoing relationship between nutrition, medicine, and human health. Papaya, nutrition, papain, and the science of nature's proteolytic enzyme. A comprehensive evidence-based review of the nutritional composition of papaya, the therapeutic potential of papain, and the science behind enzyme combinations. Papaya, Carica papaya, is among the most nutritious tropical fruits, prized not only for its sweet flavor and vibrant orange flesh, but also for its remarkable concentration of vitamins, carotenoids, and naturally occurring digestive enzymes. Indigenous to tropical America but now cultivated throughout Asia, Africa, the Pacific, and Latin America, papaya has become an important food crop and a long-standing component of traditional medicine. Modern nutritional science has largely validated papaya's reputation as a health-promoting food. It is naturally low in kilocalories yet rich in vitamin C, dietary fiber, and antioxidant phytochemicals. In addition to these nutritional attributes, papaya is unique among commonly consumed fruits because it contains papain, one of the best-known plant-derived proteolytic enzymes. Papaya has attracted scientific interest for more than a century. Commercially extracted from the milky latex of unripe papaya, the enzyme has found applications ranging from meat tenderizers and brewing to pharmaceutical preparations, wound management, and digestive enzyme supplements. More recently, researchers have investigated whether papain, either alone or in combination with other enzymes such as bromelain, might help reduce inflammation, promote recovery after injury, and support gastrointestinal health. The scientific picture, however, is nuanced. While some traditional uses have been confirmed through clinical studies, many of the broader health claims circulating on the internet remain supported primarily by laboratory experiments, animal research, or relatively small human trials. Consequently, it is important to distinguish between well-established therapeutic applications and areas where evidence remains preliminary. This review examines what is currently known about papaya and papain, drawing upon nutritional databases, clinical studies, and contemporary biomedical research. It also explores the differences between ripe and green papaya, the complementary roles of papain and bromelain, and the growing interest in multi-enzyme formulations used in both digestive health and inflammatory disorders. The papaya plant. Papaya belongs to the family Caricaceae and is scientifically known as Carica papaya. Although commonly referred to as a tree, it is technically a giant herb because its trunk lacks the woody tissues found in true trees. Under favorable tropical conditions, papaya grows rapidly and may begin producing fruit within 8 to 12 months after planting. Mature plants commonly reach heights of between 3 and 10 meters, bearing large, deeply lobed leaves arranged in a spiral at the apex of the trunk. The fruit varies considerably in size depending upon cultivar. Smaller varieties may weigh only a few hundred grams, whereas large commercial cultivars frequently exceed 1 kilogram. As the fruit ripens, the skin changes from green to yellow or orange, while the flesh develops its characteristic salmon-orange color through the accumulation of carotenoid pigments. Virtually every part of the plant has been utilized in traditional medicine. The ripe fruit is consumed fresh, while immature green papaya is widely used as a vegetable in Southeast Asian cuisine. The seeds have been employed traditionally as a condiment and antiparasitic remedy, although robust clinical evidence supporting medicinal use remains limited. The leaves are commonly prepared as herbal infusions in various cultures, while the latex serves as the principal commercial source of papain. Nutritional composition of ripe papaya. Ripe papaya is a nutrient-dense food characterized by a high water content, low energy density, and abundant vitamin C. Approximately 88% of the edible portion consists of water, making papaya both refreshing and naturally hydrating. Per 100 grams of edible ripe fruit, papaya provides approximately water, 88.1 grams. Energy, 43 kilocalories, 179 kilojoules. Protein, 0.47 grams. Total fat, 0.26 grams. Carbohydrate, 10.82 grams. Dietary fiber, 1.7 grams. Total sugars, 7.82 grams. Despite its sweet taste, papaya remains relatively low in kilocalories compared with many processed snacks and desserts. Most of its carbohydrate consists of naturally occurring sugars, principally glucose and fructose, accompanied by modest quantities of dietary fiber that help moderate postprandial glycemic responses. The fruit contains negligible fat and very little protein. Consequently, papaya is best regarded as an excellent source of micronutrients and phytochemicals, rather than a significant contributor of protein or essential fatty acids. Mineral content. Although papaya is not exceptionally rich in minerals compared with legumes or leafy vegetables, it contributes useful amounts of several essential elements. Typical values per 100 grams include calcium, 20 milligrams, iron, 0.25 milligrams, magnesium, 21 milligrams, phosphorus, 10 milligrams, potassium, 182 milligrams, sodium, 8 milligrams, zinc, 0.08 milligrams, copper, 0.045 milligrams, manganese, 0.04 milligrams, selenium, 0.6 micrograms. The relatively high potassium content, coupled with very low sodium levels, makes papaya compatible with dietary patterns designed to support healthy blood pressure. Nevertheless, papaya should not be regarded as a major potassium source when compared with foods such as potatoes, beans, or bananas. Vitamins. The outstanding nutritional feature of papaya is its exceptionally high concentration of vitamin C. 100 grams of ripe fruit supplies approximately 60.9 milligrams of ascorbic acid, sufficient to provide most, or, depending on national dietary reference values, all of an adult's recommended daily intake. Vitamin C performs numerous physiological functions. It is essential for collagen synthesis, supports normal immune function, enhances the absorption of non-heme iron from plant foods, and serves as one of the body's principal water-soluble antioxidants. Papaya also provides useful quantities of several B-complex vitamins, including thiamine, riboflavin, niacin, pantothenic acid, vitamin B6, and folate. Although individually modest, together these nutrients contribute to normal energy metabolism and cellular function. The fruit contains moderate amounts of vitamin A activity, derived primarily from provitamin A carotenoids rather than preformed retinol. These carotenoids become increasingly abundant as the fruit ripens and develops its characteristic orange pigmentation. Carotenoids, more than just color. The rich orange flesh of ripe papaya reflects a diverse mixture of carotenoid pigments, many of which possess antioxidant properties. Among the most important are beta-carotene, beta-cryptoxanthin, lycopene, lutein, zeaxanthin. Beta-carotene and beta-cryptoxanthin can be converted by the human body into vitamin A according to physiological requirements. This makes papaya a valuable contributor to vitamin A intake, although it contains considerably lower concentrations than vegetables such as carrots or sweet potatoes. Lycopene deserves particular attention. Better known as the dominant carotenoid in tomatoes, lycopene is also abundant in ripe papaya and contributes substantially to the fruit's red-orange color. Numerous observational studies associate higher dietary lycopene intake with better long-term cardiovascular health and reduced oxidative stress. However, such associations should not be interpreted as proof that lycopene alone prevents chronic disease. Lutein and zeaxanthin accumulate preferentially within the retina, particularly in the macula, where they form the macular pigment. These carotenoids help absorb high-energy blue light and possess antioxidant properties. Although papaya is not among the richest dietary sources of lutein and zeaxanthin, regular consumption can contribute modestly to total dietary intake alongside green leafy vegetables. Fat composition. Papaya contains almost no fat. Its total lipid content is approximately 0.26 grams per 100 grams, consisting mainly of small amounts of unsaturated fatty acids. Saturated fat, 0.081 grams. Monounsaturated fat, 0.072 grams. Polyunsaturated fat, 0.058 grams. As expected for a plant food, papaya contains no cholesterol. The extremely low fat content contributes to its low energy density, making it an attractive component of dietary patterns aimed at weight management without sacrificing micronutrient intake. Typical serving sizes. The nutritional contribution of papaya depends upon portion size. A typical cup of cubed ripe papaya weighing approximately 145 grams provides around 62 kilocalories, 88 milligrams of vitamin C, 2.5 grams of dietary fiber. Even a generous serving, therefore, supplies relatively few kilocalories while delivering substantial amounts of vitamin C and a variety of beneficial phytochemicals. These characteristics explain why papaya is frequently recommended as part of dietary patterns emphasizing nutrient density rather than calorie density. Health benefits of ripe papaya. The nutritional profile of ripe papaya makes it an excellent example of a nutrient-dense, low-calorie food. Rather than acting through a single superfood mechanism, its health benefits arise from the combined effects of vitamin C, dietary fiber, carotenoids, potassium, and numerous other phytochemicals that work together within the context of an overall healthy dietary pattern. It is therefore more accurate to regard papaya as one component of a balanced, predominantly whole food, plant-centered diet, rather than as a medicinal food capable of preventing or curing disease on its own. An outstanding source of vitamin C. Among commonly consumed tropical fruits, papaya ranks as one of the richest natural sources of vitamin C. A single serving of approximately 145 grams provides around 88 milligrams of vitamin C, comfortably meeting the recommended daily intake for most adults. Vitamin C serves numerous physiological functions beyond its well-known role in immunity. It is essential for the synthesis of collagen, the principal structural protein found in skin, blood vessels, bones, cartilage, and connective tissues. Without adequate vitamin C, collagen production becomes impaired, resulting in poor wound healing and, in severe deficiency, scurvy. Vitamin C also enhances the intestinal absorption of non-He iron from plant foods. Consuming papaya alongside legumes, leafy vegetables, or whole grains may therefore modestly improve iron bioavailability, particularly in individuals consuming predominantly plant-based diets. In addition, vitamin C functions as one of the body's principal water-soluble antioxidants, helping protect cells against oxidative damage generated during normal metabolism. Dietary fiber and digestive health. Papaya contributes modest but useful quantities of dietary fiber. Although approximately 1.7 grams per 100 grams may appear relatively modest compared with legumes or whole grains, Regular fruit consumption contributes meaningfully towards total daily fiber intake. Dietary fiber performs several important physiological functions. It increases stool bulk, promotes regular bowel movements, supports a healthy intestinal microbiome through fermentation by beneficial bacteria, and contributes to satiety after meals. Unlike concentrated fiber supplements, fruit delivers fiber together with water, vitamins, minerals, and thousands of phytochemicals, making whole fruits nutritionally superior to isolated fiber products for most people. Carotenoids and antioxidant protection. Papaya owes its characteristic orange-red flesh to a mixture of carotenoid pigments. These compounds possess antioxidant activity, meaning they can neutralize certain reactive oxygen species generated during normal metabolism. The principal carotenoids include beta-carotene, beta-cryptoxanthin, lycopene, lutein, zeaxanthin. Each exhibits somewhat different biological properties. Beta-carotene and beta-cryptoxanthin function as provitamin A carotenoids. The body converts these compounds into vitamin A according to physiological need, reducing the risk of excessive vitamin A intake that may occur with high-dose retinol supplements. Lycopene has attracted considerable research interest because observational studies consistently associate higher dietary intake with improved cardiovascular health. However, randomized clinical trials have produced more mixed findings, suggesting that lycopene probably acts as one component of an overall healthy dietary pattern rather than as an isolated therapeutic compound. Eye health. Papaya contributes several nutrients associated with normal visual function. Vitamin C supports the health of ocular tissues by participating in collagen synthesis and antioxidant defense. Beta-carotene contributes to vitamin A production, which is essential for normal vision, particularly under low-light conditions. Lutein and zeaxanthin accumulate within the macula of the retina, where they help filter high-energy blue light and reduce oxidative stress. Although papaya contains significantly lower concentrations of lutein and zeaxanthin than dark green leafy vegetables such as kale or spinach, regular consumption may still contribute modestly to overall dietary intake. Current evidence supports obtaining these carotenoids primarily through a varied diet, rather than relying exclusively upon supplements. Cardiovascular health. Several nutritional characteristics of papaya may support long-term cardiovascular health. The fruit contains very little sodium while supplying moderate quantities of potassium. Diets rich in potassium-containing fruits and vegetables have consistently been associated with healthier blood pressure levels. Its high vitamin C content and diverse antioxidant phytochemicals may also help reduce oxidative stress, an important contributor to vascular aging. Furthermore, replacing energy-dense processed desserts with fresh fruit such as papaya may reduce overall dietary energy intake while increasing micronutrient density. Nevertheless, no convincing evidence demonstrates that papaya itself prevents heart disease independently of an overall healthy lifestyle. Weight management. Papaya is naturally low in energy density. 100 grams provides only about 43 kilocalories while containing almost 90% water. Foods with low energy density allow larger portions to be consumed for relatively few kilocalories, helping promote satiety while facilitating weight management. This principle has been extensively investigated by nutritional scientists and forms part of evidence-based dietary approaches for obesity prevention. Papaya therefore fits well within dietary patterns, emphasizing fruits, vegetables, legumes, and whole grains. Its naturally sweet flavor may also satisfy cravings for desserts while providing substantially greater nutritional value than refined confectionery. Glycemic considerations. Despite containing natural sugars, papaya generally has a relatively modest glycemic load because of its high water content and comparatively low carbohydrate concentration. The fruit contains approximately 10.8 grams of carbohydrate and 7.8 grams of naturally occurring sugars per 100 grams. For most healthy individuals, moderate portions of ripe papaya can readily be incorporated into balanced meals. People with diabetes do not generally need to avoid papaya, although portion size and overall carbohydrate intake remain important considerations. Current diabetes guidelines emphasize total dietary patterns rather than excluding individual fruits, solely because they contain natural sugars. Papain, nature's protein-digesting enzyme. Although ripe papaya is nutritionally impressive, much of the scientific interest surrounding the papaya plant focuses upon papain. Papain is one of the best-known plant proteolytic enzymes, or proteases. Its primary biological function is to break down proteins into smaller peptides and amino acids. Commercial papain is extracted mainly from the white latex that exudes when immature green papaya fruits are scored or incised. Smaller quantities are also present in the leaves, stems, and roots. As the fruit ripens, papain activity declines markedly. Consequently, ripe papaya contains considerably lower concentrations of active enzyme than unripe fruit. Discovery and commercial importance. Papain has been used commercially since the 19th century. Its ability to digest proteins led rapidly to applications in food processing, particularly as a meat tenderizer. The enzyme hydrolyses collagen and muscle proteins, making tougher cuts of meat noticeably more tender after marination. Today, papain has numerous industrial applications, including meat tenderizing, brewing, baking, clarification of beverages, leather processing, textile manufacture, cosmetics, pharmaceuticals, digestive enzyme supplements, biomedical research. Its remarkable stability over a relatively broad temperature and pH range has contributed to its commercial success. How papain works? Papain belongs to a family of enzymes known as cysteine proteases. These enzymes possess a highly reactive cysteine residue within their active site. When dietary proteins enter the digestive tract, papain attacks peptide bonds linking amino acids together. Rather than digesting proteins completely in a single step, papain progressively breaks large protein molecules into smaller peptides, which are then further degraded into individual amino acids by other digestive enzymes. Unlike some digestive enzymes that function optimally only under very acidic conditions, papain remains active across a relatively broad pH range. This property has contributed to suggestions that it may retain activity under varying gastrointestinal conditions. Papain in human digestion. Healthy individuals normally digest dietary protein efficiently using their own digestive enzymes, including pepsin produced in the stomach and pancreatic enzymes such as trypsin and chymotrypsin. Consequently, most healthy people do not require supplemental papain. However, digestive enzyme supplements may prove useful in selected circumstances. These include individuals with reduced pancreatic enzyme production, certain digestive disorders, or age-related reductions in digestive efficiency. Papain-containing supplements are therefore marketed primarily as digestive aids rather than essential nutritional products. It is important to recognize that evidence supporting routine enzyme supplementation in healthy adults remains limited. For most people, consuming adequate dietary protein within a balanced diet is sufficient for normal digestion. Clinical evidence for digestive benefits. Several small clinical studies have investigated papaya preparations or papain-containing enzyme products in people experiencing functional digestive complaints. Some participants reported improvements in symptoms including bloating, excessive intestinal gas, abdominal discomfort, constipation, feelings of incomplete digestion. One frequently cited trial involving a concentrated fermented papaya preparation demonstrated improvements in several gastrointestinal symptoms over the study period. However, interpretation requires caution. Many studies have involved relatively small numbers of participants, short follow-up periods, or proprietary formulations containing multiple active ingredients. Consequently, while the available evidence suggests papain may assist some individuals experiencing functional digestive symptoms, larger, well-designed, randomized controlled trials are still needed before firm conclusions can be drawn. Current evidence therefore supports papain as a potentially useful digestive aid rather than a universally necessary supplement. Papain and irritable bowel syndrome. Interest has also extended to irritable bowel syndrome, IBS, a common functional gastrointestinal disorder characterized by abdominal pain associated with altered bowel habits. A few small studies have suggested that papaya-based preparations may reduce bloating, constipation, and abdominal discomfort in some patients. However, the evidence remains preliminary. No major gastroenterology society currently recommends pain as a standard treatment for IBS. Established management strategies including dietary modification, adequate fiber intake where appropriate, psychological therapies for selected patients, and evidence-based medications remain the foundation of treatment. Papain should therefore be regarded, at most, as a possible adjunct rather than a proven therapy. Topical papain in wound care. Although papain is best known as a digestive enzyme, one of its most established medical applications has been in wound management. Unlike oral supplementation, where clinical evidence remains relatively limited, topical papain has a long history of use as an enzymatic debriding agent. Debridement refers to the removal of dead, damaged, or necrotic tissue from a wound, thereby promoting the formation of healthy granulation tissue and facilitating healing. When applied appropriately under medical supervision, papain selectively digests devitalized proteins while largely sparing healthy tissue. This enzymatic action can reduce the need for more aggressive mechanical debridement in selected patients. Historically, papain preparations were used in the treatment of pressure ulcers, diabetic ulcers, burns, and chronic wounds. In many formulations, papain was combined with urea, which softened necrotic tissue and enhanced the enzyme's activity. Clinical studies have demonstrated that papain-based preparations can accelerate wound cleaning and, in some cases, shorten healing times compared with conventional dressings alone. Nevertheless, evidence varies according to wound type, study design, and the specific formulation employed. Over the past 2 decades, some papain-containing products have been withdrawn or reformulated because of concerns regarding allergic reactions. Consequently, wound care practice has increasingly shifted towards newer enzymatic agents, hydrogels, and advanced wound dressings. Nevertheless, papain continues to be used in certain countries and remains an important milestone in the development of modern enzymatic wound therapy. For patients with chronic wounds, treatment should always be guided by healthcare professionals. Self-treatment with concentrated papain preparations is inappropriate for serious wounds, infected ulcers, or extensive burns. Anti-inflammatory properties. Inflammation is a complex biological response involving immune cells, cytokines, enzymes, and numerous signaling pathways. Laboratory studies have shown that papain can influence several components of the inflammatory response. Experimental research suggests reductions in inflammatory mediators including tumor necrosis factor alpha, TNF-alpha, interleukin-1 beta, IL-1 beta, and interleukin-6, IL-6, together with modulation of intracellular signaling pathways such as nuclear factor kappa B, NF-kappa B. These findings have generated considerable scientific interest. However, it is important to distinguish laboratory observations from proven clinical benefits. Most mechanistic studies have been conducted using cultured cells or experimental animals. Human studies remain comparatively few, often involving small numbers of participants and differing formulations, making direct comparisons difficult. At present, the evidence suggests that papain possesses biologically plausible anti-inflammatory properties, but larger, well-controlled clinical trials are required before it can be recommended as an established anti-inflammatory treatment. Exercise recovery and muscle soreness. Delayed onset muscle soreness, DOMS, commonly develops after strenuous or unfamiliar exercise, particularly activities involving eccentric muscle contractions. Researchers have investigated whether proteolytic enzymes might accelerate recovery by reducing inflammation and facilitating the clearance of damaged proteins. Several small clinical trials have reported reductions in muscle soreness and improvements in perceived recovery among athletes receiving enzyme supplements. However, an important limitation should be recognized. Most studies have not evaluated papain alone. Instead, participants receive proprietary enzyme blends containing combinations of papain, bromelain, fungal proteases, trypsin, chymotrypsin, or other ingredients. Consequently, the specific contribution made by papain cannot easily be determined. The available evidence is encouraging but remains insufficient to recommend papain routinely for exercise recovery. Adequate sleep, progressive training, balanced nutrition, and sufficient protein intake remain the cornerstones of athletic recovery. Bromelain, papain's closest botanical counterpart. The enzyme most frequently paired with papain is bromelain. Bromelain is extracted principally from the stem of the pineapple, Ananas commosus, although smaller quantities are also present in the fruit itself. Like papain, bromelain belongs to the cysteine protease family and breaks down proteins into smaller peptides. Despite these similarities, the two enzymes are not identical. Each exhibits different substrate preferences and enzymatic characteristics. As a result, they may complement one another when used together. Bromelain has been studied more extensively than papain in relation to inflammation, tissue swelling, and post-operative recovery. Several systematic reviews suggest that bromelain may modestly reduce pain, bruising, and swelling following dental surgery, orthopedic procedures, and certain traumatic injuries. Nevertheless, study quality remains variable, and results have not always been consistent. Papain and bromelain together. Because papain and bromelain digest proteins in slightly different ways, manufacturers frequently combine them in digestive enzyme supplements. The rationale is straightforward. A broader range of proteolytic activity may improve the digestion of complex dietary proteins more effectively than either enzyme alone. In laboratory settings, the two enzymes also demonstrate complementary actions upon damaged proteins and inflammatory mediators. This has led researchers to investigate whether combined enzyme therapy might produce additive or even synergistic effects. The concept of synergy should, however, be interpreted carefully. True pharmacological synergy requires the combined effect to exceed the sum of the individual effects. Although some experimental studies suggest this may occur, few high-quality clinical trials have directly compared papain plus bromelain against either enzyme alone. Most available research has instead evaluated proprietary multi-enzyme formulations containing numerous active ingredients. Consequently, current evidence supports the biological plausibility of complementary activity, but falls short of conclusively demonstrating unique synergy between papain and bromelain alone. Multi-enzyme therapy. Interest in systemic enzyme therapy emerged during the 20th century, particularly in Europe. Unlike digestive enzyme supplements, which are intended to assist digestion within the gastrointestinal tract, systemic enzyme therapy proposes that specially formulated enzymes survive digestion, are absorbed into the circulation and exert anti-inflammatory effects throughout the body. To maximize this possibility, systemic enzyme products are typically manufactured with enteric coatings designed to protect enzymes from stomach acid until they reach the small intestine. Among the best-known formulations are combinations containing bromelain, trypsin, and the flavonoid rutoside, also known as rutin. Some products additionally include papain, chymotrypsin, or microbial proteases. These formulations have been investigated for conditions including osteoarthritis, sports injuries, post-operative recovery, soft tissue trauma, chronic inflammatory disorders. The proposed mechanisms include modulation of inflammatory cytokines, enhancement of alpha-2 macroglobulin activity, reduction of edema, and facilitation of fibrin breakdown. While these mechanisms are biologically plausible, debate continues regarding the extent to which orally administered enzymes remain active after absorption, and whether sufficient quantities reach target tissues to produce clinically meaningful effects. Osteoarthritis. Among the various applications studied, osteoarthritis possesses one of the stronger evidence bases for systemic enzyme therapy. Several randomized controlled trials have compared enzyme combinations, particularly bromelain, trypsin, and rutoside, with non-steroidal anti-inflammatory drugs, NSAIDs, such as diclofenac. Many studies have reported improvements in pain, joint stiffness, and physical function comparable to those achieved with NSAIDs. Importantly, enzyme therapy generally produced fewer gastrointestinal adverse effects than long-term NSAID treatment. Nevertheless, several caveats deserve emphasis. Many studies have involved proprietary formulations rather than isolated enzymes. Some trials were sponsored by manufacturers. Sample sizes have often been modest. Consequently, while systematic reviews conclude that enzyme combinations may represent a useful adjunctive treatment for selected patients with osteoarthritis, they are not currently recommended as first-line therapy in major international clinical guidelines. Exercise therapy, weight management, patient education, and appropriate analgesics remain the foundations of evidence-based osteoarthritis management. Emerging areas of research. Researchers continue to investigate papain and related proteolytic enzymes in numerous experimental settings. These include modulation of the intestinal microbiome, regulation of immune function, chronic inflammatory skin disorders, enhancement of wound healing, reduction of oxidative stress, adjunctive cancer research, antimicrobial activity, antiparasitic applications. Much of this work remains at the laboratory or animal research stage. Although the findings are scientifically interesting, they should not be interpreted as demonstrating clinical efficacy in humans. Claims that papain prevents cancer, treats autoimmune disease, or substantially alters the gut microbiome remain speculative and unsupported by robust clinical evidence. Such claims frequently appear in commercial marketing materials, but extend considerably beyond the available scientific data. Responsible interpretation requires distinguishing clearly between hypothesis-generating research and treatments supported by high-quality clinical trials. Papain in food processing. Outside medicine, papain has become one of the food industry's most valuable natural enzymes. Its best-known application is meat tenderization. By breaking down collagen and muscle proteins, papain softens relatively tough cuts of meat without significantly altering flavor. The enzyme is also used in brewing, where it helps prevent protein haze in beer. Additional applications include baking, clarification of fruit juices, preparation of protein hydrolysates, and certain specialized dairy and confectionery processes. These industrial uses illustrate the remarkable versatility of papain and underscore the reliability of its protein-digesting properties, one of the best established aspects of its biology. Green papaya, a different food with a different nutritional profile. Although green and ripe papaya come from the same plant, they differ considerably in both nutritional composition and culinary use. Green papaya is simply the immature fruit harvested before the natural ripening process begins. At this stage, the flesh is firm, crisp, and pale green to white rather than the characteristic orange or salmon color of ripe fruit. Its flavor is mild and only slightly sweet, making it more comparable to a vegetable than a dessert fruit. Throughout Southeast Asia, green papaya is an important culinary ingredient. It is shredded into salads, incorporated into curries and soups, stir-fried, pickled, or braised with meat and seafood. Perhaps the best-known preparation is the Thai salad somtam, in which finely shredded green papaya is combined with chilies, garlic, tomatoes, lime juice, fish sauce, and roasted peanuts. Unlike ripe papaya, which is generally eaten fresh, green papaya is valued primarily for its texture rather than its sweetness. Nutritional composition of green papaya. Food composition data for green papaya are less comprehensive than for ripe fruit, because most national food composition databases focus on the edible ripe stage. Published analyses nevertheless show a consistent overall pattern. Green papaya is lower in energy, lower in sugars, and slightly higher in water content than ripe papaya. Typical values per 100 grams of edible portion are approximately: water, 90 to 92 grams. Energy, 27 to 35 kilocalories. Protein, 0.4 to 2.1 grams. Total fat, approximately 0.1 grams. Carbohydrate, 5 to 7 grams. Dietary fiber, 1.9 to 2.1 grams. The most obvious nutritional difference is the substantially lower sugar content. Whereas ripe papaya contains nearly 8 grams of naturally occurring sugars per 100 grams, green papaya generally contains only around 2 to 3 grams. Consequently, green papaya has a milder taste and a lower energy density. Vitamins and minerals. Green papaya provides useful amounts of vitamin C, although reported values vary considerably according to cultivar, growing conditions, and stage of maturity. Published analyses range from approximately 20 to 75 milligrams per 100 grams. Some varieties contain vitamin C concentrations approaching those of ripe fruit, whereas others contain substantially less. Mineral concentrations are broadly similar to those found in ripe papaya. Green papaya may contain slightly higher levels of calcium, magnesium, and potassium, although differences are generally modest and should not be overstated. The most striking nutritional contrast concerns carotenoids. Because carotenoid synthesis occurs primarily during ripening, green papaya contains very little beta-carotene, beta-cryptoxanthin, or lycopene. These pigments accumulate progressively as chlorophyll breaks down and the fruit develops its characteristic orange color. For this reason, ripe papaya is nutritionally superior as a source of provitamin A, carotenoids, and lycopene. Papain concentration. The defining feature of green papaya is its exceptionally high concentration of papain. The enzyme occurs principally within the white latex that exudes when immature fruit is cut. This latex contains a mixture of proteolytic enzymes, including papain, chymopapain, and several related cysteine proteases. As the fruit ripens, enzyme activity declines markedly. The ripe fruit therefore contributes relatively little active papain, despite retaining its excellent nutritional profile. Commercial papain production relies almost entirely upon repeated collection of latex from carefully scored immature fruits. The latex is subsequently dried and purified to produce pharmaceutical and food-grade papain preparations. Traditional uses. Green papaya has been employed for centuries in traditional systems of medicine throughout Asia, Africa, and Latin America. Traditional uses have included digestive support, meat tenderizing, topical treatment of minor skin lesions, treatment of intestinal parasites, support during convalescence, herbal preparations for various inflammatory conditions. Some of these traditional practices have subsequently attracted scientific investigation. Others remain supported primarily by historical usage rather than modern clinical evidence. Traditional use should therefore be regarded as a source of research hypotheses rather than proof of therapeutic effectiveness. Green papaya in modern nutrition. Green papaya fits well into dietary patterns emphasizing minimally processed plant foods. Because it is lower in sugars than the ripe fruit, it can be incorporated into savory meals without substantially increasing carbohydrate intake. Its crisp texture also makes it an excellent substitute for higher energy ingredients in salads and stir-fries. Unlike many starchy vegetables, green papaya remains relatively low in kilocalories while providing fiber, vitamin C and various minerals. However, cooking substantially reduces papain activity because the enzyme is denatured by heat. Individuals consuming green papaya primarily for its enzyme content should therefore recognize that prolonged cooking diminishes this characteristic. Fortunately, the nutritional value of the vegetable itself remains largely intact, despite loss of enzymatic activity. Safety considerations. For the overwhelming majority of healthy adults, eating ripe papaya as part of a balanced diet is entirely safe. Nevertheless, several important precautions deserve consideration. Latex allergy. Individuals allergic to natural rubber latex may experience cross-reactivity with papaya. This phenomenon, known as the latex fruit syndrome, occurs because certain proteins found in papaya resemble those present in natural latex. Cross-reactivity has also been reported with fruits including kiwi, avocado, banana, chestnut, and, less commonly, figs. Symptoms may include itching of the mouth, swelling of the lips or tongue, hives, gastrointestinal discomfort, wheezing, anaphylaxis in rare cases. Anyone with a known latex allergy should exercise caution when consuming papaya for the first time, particularly green papaya, which contains substantially more latex than ripe fruit. Pregnancy. One of the oldest cautions surrounding papaya concerns pregnancy. This recommendation applies principally to unripe or partially ripe papaya rather than fully ripe fruit. The latex of immature papaya contains papain and other biologically active compounds that, in laboratory and animal studies, have demonstrated uterine-stimulating properties. Although convincing evidence of harm in humans is limited, most healthcare authorities advise pregnant women to avoid consuming large quantities of green papaya or papaya latex preparations as a precautionary measure. Fully ripe papaya contains much lower concentrations of latex and is generally considered safe when eaten in normal food amounts as part of a balanced diet. Digestive supplements. Papain consumed naturally within food is unlikely to cause adverse effects. Problems are more likely to arise with concentrated supplements. Large doses may irritate the mouth, throat, esophagus, or stomach. Occasionally, nausea, abdominal discomfort, or diarrhea may occur. As with any supplement, more is not necessarily better. Individuals should follow manufacturers' recommended dosages unless otherwise advised by a qualified healthcare professional. Drug interactions. Proteolytic enzyme supplements may interact with certain medications. Particular caution has been advised for people taking anticoagulant or antiplatelet drugs such as warfarin, apixaban, rivaroxaban or clopidogrel, because bromelain and, to a lesser extent, papain may theoretically increase bleeding risk. Evidence remains limited, but prudence is warranted until more definitive studies become available. There is also limited evidence suggesting possible interactions with blood glucose regulation. Individuals taking medication for diabetes should therefore monitor blood glucose appropriately if commencing concentrated enzyme supplements. Because papain supplements are biologically active preparations, they should ideally be discontinued before major surgery in accordance with medical advice. Who should seek medical advice? Medical guidance is advisable before taking papain supplements if an individual is pregnant or breastfeeding, has a bleeding disorder, is taking anticoagulants or antiplatelet medicines, has significant gastrointestinal disease, has a history of severe food or latex allergy, is preparing for surgery, is considering long-term supplementation. These precautions relate primarily to concentrated enzyme products rather than ordinary dietary consumption of ripe papaya. Practical dietary advice. For most people, the simplest recommendation is also the best. Eat papaya as a fresh whole fruit within the context of a varied, predominantly whole food dietary pattern. Ripe papaya makes an excellent breakfast fruit, snack or dessert, and pairs well with other tropical fruits, oats, yogurt alternatives, and smoothies. Green papaya offers a nutritious vegetable option for savory dishes and provides culinary diversity while contributing fiber and vitamin C. Neither form should be regarded as a miracle food. The greatest health benefits arise not from any single fruit, but from consistently consuming a wide variety of fruits, vegetables, legumes, whole grains, nuts and seeds, while limiting highly processed foods rich in added sugars, refined starches and saturated fats. Papaya seeds, traditional uses, nutritional value and scientific evidence. The often overlooked component of the papaya fruit. While the sweet orange flesh of ripe papaya is widely consumed throughout the world, the small black seeds contained within the fruit are usually discarded. However, papaya seeds have attracted increasing interest because of their distinctive flavor, nutritional composition, and long history of traditional use. Fresh papaya seeds have a sharp, peppery taste with a slightly bitter undertone. In some cultures, they are dried, ground, and used as a spice substitute, occasionally replacing black pepper because of their pungent flavor. Beyond their culinary applications, papaya seeds have been used traditionally in various regions for digestive support, intestinal parasite control, and general health purposes. Modern scientific investigation has examined these traditional claims, particularly the seed's potential antimicrobial, antiparasitic, and antioxidant properties. However, as with papaya research, it is essential to distinguish between promising laboratory findings and proven clinical benefits. Nutritional composition of papaya seeds. Compared with the ripe fruit pulp, papaya seeds have a very different nutritional profile. They contain considerably more fat, protein, and bioactive plant compounds. The seeds provide healthy unsaturated fatty acids, plant proteins, dietary fiber, polyphenolic compounds, flavonoids, glucosinolates, benzyl isothiocyanate. Benzyl isothiocyanate is one of the most studied compounds in papaya seeds. It contributes to their characteristic peppery flavor and has demonstrated antimicrobial activity in laboratory studies. The fatty acid profile of papaya seed oil is dominated by unsaturated fats, particularly oleic acid and other monounsaturated fatty acids. Because the seeds are small and usually consumed in modest quantities, they are unlikely to make a major contribution to total dietary fat intake unless eaten regularly in larger amounts. Traditional use against intestinal parasites. One of the most widely repeated claims about papaya seeds is their ability to eliminate intestinal parasites. This traditional use is particularly common in parts of Africa, Asia, and Central America. Scientific interest increased after several studies investigated papaya seed preparations in children and animals. One small human study involving children with intestinal parasites reported that a preparation containing dried papaya seeds and honey was associated with improved parasite clearance. However, the evidence base remains limited. The study involved a relatively small number of participants, and more extensive clinical trials are required before papaya seeds can be recommended as a standard antiparasitic treatment. Established medical therapies remain the appropriate approach for confirmed parasitic infections. Papaya seeds may be an interesting traditional food, but they should not replace evidence-based diagnosis and treatment. Antimicrobial properties. Laboratory research has demonstrated that papaya seed extracts can inhibit the growth of certain bacteria and fungi. Researchers have attributed these effects partly to benzyl isothiocyanate and other phytochemicals. Such findings have generated interest in possible applications in food preservation and antimicrobial research. However, antimicrobial activity observed in test tubes does not automatically translate into therapeutic effectiveness in humans. The concentration required to inhibit microorganisms in laboratory experiments may not be achievable safely through normal dietary consumption. Consequently, papaya seeds should be viewed as a source of bioactive compounds rather than as a natural antibiotic. Antioxidant activity. Papaya seeds contain polyphenols and flavonoids capable of neutralizing reactive oxygen species in laboratory assays. Antioxidants from plant foods contribute to the body's overall defense system against oxidative stress. However, antioxidant activity measured in chemical experiments does not directly predict health outcomes in humans. The human body possesses complex antioxidant systems involving enzymes, vitamins, minerals, and metabolic pathways. A diet rich in a wide variety of plant foods provides a broad spectrum of protective compounds rather than relying upon a single concentrated source. Papaya seeds and digestive health. Traditional practitioners have sometimes recommended papaya seeds for digestive complaints. The proposed mechanisms include antimicrobial effects against certain intestinal organisms, contribution of dietary fiber, stimulation of digestive processes through bioactive compounds. However, strong clinical evidence supporting routine use for digestive disorders remains lacking. The seeds are more concentrated and biologically active than the fruit pulp, meaning that excessive consumption may cause gastrointestinal discomfort. Bitter and pungent compounds that contribute to their flavor can irritate the digestive tract in sensitive individuals. Safety considerations. Although small amounts of papaya seeds consumed occasionally as a food ingredient are generally considered safe for healthy adults, concentrated or excessive consumption requires caution. Pregnancy. Pregnant women should avoid large amounts of papaya seeds. Animal studies have raised concerns about possible effects on fertility and reproduction, although the relevance of these findings to normal human dietary intake remains uncertain. As a precaution, concentrated papaya seed preparations are generally discouraged during pregnancy. Fertility concerns. Some animal studies have reported reduced sperm count or altered reproductive parameters following high doses of papaya seed extracts. These findings have contributed to traditional beliefs regarding contraceptive properties. However, human evidence is insufficient to establish whether normal dietary consumption affects fertility. Nevertheless, individuals attempting to conceive should avoid consuming large quantities of concentrated papaya seed products until more evidence is available. Gastrointestinal effects. Because papaya seeds contain potent phytochemicals, excessive intake may cause nausea, stomach irritation, abdominal discomfort, diarrhea. Moderation is therefore advisable. Culinary use of papaya seeds. For those who enjoy their distinctive flavor, papaya seeds may be incorporated into the diet in small quantities. Common uses include grinding dried seeds as a pepper substitute, adding a small amount to salad dressings, blending a few seeds into smoothies, mixing crushed seeds with marinades. Their intense flavor means that only a small quantity is usually required. They should be regarded primarily as a culinary ingredient rather than a therapeutic supplement. Papaya seeds versus papain supplements. A common misconception is that consuming papaya seeds provides the same benefits as taking papain supplements. This is incorrect. Papain is concentrated primarily in the latex of unripe papaya fruit, not in the seeds. The seeds contain different bioactive compounds, particularly benzyl isothiocyanate and polyphenols. Therefore, ripe papaya provides vitamins, fiber, and carotenoids. Green papaya provides higher papain activity. Papaya latex provides commercial papain. Papaya seeds provide different phytochemicals with separate biological properties. Each component of the plant has a distinct chemical profile. Overall assessment. Papaya seeds represent an interesting example of how traditional food practices can stimulate scientific research. Their peppery flavor, unique phytochemical composition, and historical medicinal use make them worthy of further investigation. Current evidence supports the presence of biologically active compounds with antimicrobial and antioxidant properties, but clinical evidence remains insufficient to justify strong health claims. The most evidence-based way to enjoy papaya remains consuming the ripe fruit for its exceptional nutritional value. Green papaya may be incorporated as a vegetable, while papain preparations have specific industrial and medical applications. Papaya seeds can be enjoyed occasionally as a flavorful food ingredient, but they should not be regarded as a proven medicine or replacement for established healthcare. The lesser-known parts of papaya, male flowers and papaya leaf juice. Culinary use of male papaya flowers. The papaya plant is unusual because it produces distinct male, female, and hermaphrodite flowers, depending upon the plant's genetics and environmental conditions. While female and hermaphrodite flowers develop into the familiar edible fruit, male flowers are usually discarded because they do not produce commercially valuable fruit. However, in several Asian culinary traditions, male papaya flowers are valued as a seasonal vegetable. The flowers are small, delicate, and typically borne in clusters on long stalks. They have a slightly bitter flavor, somewhat similar to bitter greens, and are appreciated for their distinctive taste rather than sweetness. In parts of Southeast Asia, the flowers are collected while still tender and prepared in a variety of ways, including stir-frying with garlic, chili, and spices, cooking in coconut-based curries, adding to soups and stews, blanching and serving with spicy dipping sauces, combining with eggs, seafood, or fermented foods. The bitterness is considered a desirable characteristic in many traditional cuisines, much like bitter melon, mustard greens, or certain medicinal herbs. Nutritional profile of male papaya flowers. Scientific nutritional databases contain far less information on papaya flowers compared with the fruit. Nevertheless, like many edible flowers and leafy plant parts, male papaya flowers are expected to contain dietary fiber, small amounts of plant protein, minerals including calcium, potassium, and magnesium, polyphenolic compounds, flavonoids, and other phytochemicals. Because they are consumed in relatively small quantities, their contribution to total nutrient intake is likely modest. Their primary nutritional value lies in adding dietary diversity and introducing additional plant compounds into the diet. Traditional medicinal uses. In traditional medicine systems, papaya flowers have been used for various purposes, including digestive complaints, respiratory symptoms, and general wellness. Some cultures consider bitter plant foods beneficial because bitter compounds may stimulate digestive secretions and appetite. However, many traditional claims have not been evaluated through rigorous clinical trials. The strongest evidence remains for their role as a nutritious edible plant food rather than as a medicine. Papaya leaf juice and dengue fever. Perhaps the most widely discussed medicinal claim involving the papaya plant concerns the use of papaya leaf juice during dengue fever. Dengue is a mosquito-borne viral infection caused by dengue virus transmitted primarily by Aedes mosquitoes. A significant complication of dengue is thrombocytopenia, or a reduction in circulating platelets. Because severe dengue may involve bleeding complications and plasma leakage, platelet monitoring is an important component of medical management. In several countries, particularly India, Malaysia, Indonesia, and parts of Southeast Asia, papaya leaf extract has become popular as a traditional remedy believed to increase platelet counts. Scientific investigation. Interest in papaya leaf arose after preliminary laboratory and clinical studies suggested that extracts from the leaves might influence platelet production. Researchers have proposed several possible mechanisms: stimulation of bone marrow activity, increased expression of platelet-related genes, antioxidant effects protecting blood cells from oxidative damage, modulation of immune responses. Some small clinical studies have reported faster increases in platelet counts among dengue patients receiving papaya leaf preparations compared with control groups. However, the evidence remains limited. Many studies have involved small sample sizes, different extraction methods, variable dosages, and inconsistent study designs. A rise in platelet count also does not necessarily mean that a treatment reduces the risk of severe dengue complications. Platelets naturally fluctuate during the course of dengue infection, and recovery often occurs as part of the normal immune response. Current medical consensus. At present, major public health authorities do not recognize papaya leaf juice as a proven treatment for dengue. The established management of dengue remains careful monitoring of symptoms, adequate fluid replacement, monitoring of platelet levels and warning signs, appropriate medical care for severe cases. There is currently no strong evidence that papaya leaf juice prevents dengue complications, reduces mortality, or replaces standard medical treatment. For patients who choose to consume papaya leaf preparations as a complementary practice, it should only be considered an adjunct and never a substitute for medical assessment. Safety considerations of papaya leaf preparations. Papaya leaves contain numerous bioactive compounds, including flavonoids, alkaloids, phenolic compounds, and enzymes. Because concentrated leaf extracts differ greatly from ordinary food consumption, safety considerations are important. Possible concerns include gastrointestinal irritation, nausea or abdominal discomfort, allergic reactions, particularly in individuals sensitive to papaya latex, uncertain effects during pregnancy. Pregnant women should avoid medicinal doses of papaya leaf preparations unless specifically advised by a healthcare professional. The quality and purity of commercially available papaya leaf products also vary considerably. Some preparations may differ substantially in concentration of active compounds, making dosage comparisons difficult. The broader lesson from papaya research: the study of papaya demonstrates an important principle in nutritional science. A plant is not a single substance but a complex biological system. The fruit, seeds, latex, flowers, and leaves each contain different combinations of nutrients and phytochemicals. Ripe papaya provides exceptional nutritional value through vitamin C, fiber, and carotenoids. Green papaya provides culinary versatility and higher papain activity. Papaya seeds contribute distinctive phytochemicals. Male flowers provide culinary diversity. Papaya leaves remain an intriguing area of research, particularly regarding dengue, but require stronger clinical evidence before their medicinal reputation can be confirmed. The most scientifically defensible conclusion is that papaya is a remarkable food plant with several interesting traditional applications, some well established, others promising but still awaiting rigorous validation. Conclusion: papaya occupies a distinctive place among tropical fruits. Its combination of low energy density, exceptionally high vitamin C content, useful quantities of dietary fiber, and diverse carotenoids makes it one of the most nutrient-dense fruits available. The ripe fruit serves primarily as a nutritional food, supplying antioxidants, vitamins, and phytochemicals that support overall health as part of a balanced diet. Green papaya, by contrast, functions both as a vegetable and as the principal natural source of papain, one of the world's most extensively studied plant proteolytic enzymes. Scientific research supports papain's established role in protein digestion and its long-standing use as an enzymatic debriding agent in selected wound care applications. Evidence for broader therapeutic effects, including anti-inflammatory activity, exercise recovery, and adjunctive use in osteoarthritis, is promising but remains less conclusive, particularly when papain is studied in isolation. Many positive findings derive from multi-enzyme formulations containing bromelain, trypsin, chymotrypsin, or other biologically active compounds rather than papain alone. Consequently, claims that papaya or papain can prevent or treat major chronic diseases should be viewed with appropriate scientific caution. The greatest strength of papaya lies not in extraordinary medicinal claims, but in its ability to provide substantial nutritional value within an enjoyable, affordable, and versatile food. When consumed regularly as part of an overall healthy dietary pattern, papaya can make a valuable contribution to long-term health, while concentrated papain preparations should be regarded as specialized products with specific clinical applications rather than universal nutritional necessities. Selected references. Primary nutrient composition data were derived principally from the United States Department of Agriculture, USDA, Food Data Central Database for Carica papaya, raw ripe fruit. Supplemented where appropriate by national food composition tables and peer-reviewed analyses of green papaya. Additional evidence was drawn from systematic reviews, randomized controlled trials, and review articles published in peer-reviewed journals covering nutritional science, enzymology, gastroenterology, wound care, sports medicine, and rheumatology. Particular emphasis was placed on human clinical studies and evidence syntheses rather than laboratory or animal investigations. End of article.